what's up? All right. Welcome, guys. Hey, Paul Kowalski, Vallejo Physical Therapy, Vallejo PT Online, and we're going to talk about the scalene release. Okay, these are the muscles that run along the side of the neck. Their primary job is accessory breathing. All right, so a lot of times if you find yourself as a computer worker, postural issues, you find yourself you sigh a lot throughout the day, maybe you hold your breath, don't realize it. These muscles will have a tendency to get tight because then we have to catch up, right? So they help to expand the upper ribs in order for our upper oxygen, or our upper areas of our lungs to get more oxygen. So again, accessory breathing muscles, there's 3 per side. They don't like being worked individually. All right, so I always recommend if you're going to work on scalenes at all that you go ahead and work on both sides. All right, easiest way to get to these bad boys, always usually work opposite sides. So my left hand's going to go to my right side, and I'm going to be right along the side of the neck. All right, and what I usually tell people is the easiest way to get after this is to kind of find the ear, all right, drop down and stay right there, directly below the ear, and maybe back just a touch. All right, but the focus is going to be on the neck itself, not down here on the upper trap. Okay, there are some spots down here you can get to, a little bit higher risk areas. So, and again, bang for buck wise, usually right up in here is where they're going to be a little bit more sore, a little bit more tension. There's my middle scalene right there, and it is a little hot. All right, so again, nice easy motion. Shouldn't be any level of discomfort that causes you to, again, hold your breath or clench your teeth. You can't push through that, especially with these muscles. They're about the size of your little finger, right? So they're not very big. Working on up, we work all the way up to the top of the neck, just by the ear. Coming on back down again, just easy motion, nothing crazy, small circles back and forth. Feel anything that feels like a heartbeat, just get off of it. Okay, they've definitely got some vessels running down through here. All right, we don't want to be pushing on vessels. All right, about 10 to 20 seconds with this particular technique, so a little bit shorter than our normal. All right, and then same thing other side. I'm gonna go to the ear, drop straight down. I'm gonna work that area right there specifically, and working on up. All right, typically after this, our activation is going to be the deep neck flexors. That's usually the muscles that these are also associated with. So we'll make sure that that deep core is doing its job so these muscles don't feel like they have to stabilize the neck. To do that, we'll come back to our full sitting up position right there. I'll explain this one first. We're going to go roof to the top of the mouth. All right, we're going to hold that up, press, really kind of press, but you want to press to where you're still able to keep the jaw relaxed. After you do that, we're going to go both hands directly under the jaw, and then we're going to look down. So that's going to look like this. Tongue up, so I'm slightly retracted, tongue up, jaw's relaxed, and now I'm going to push down. Maintain that tongue pressure. Keep the jaws relaxed. So that's going to be our deep neck flexor activation technique coming off of the scalenes. The first rib. All right, sometimes we can have issues with our first rib on either side. First rib attaches to one of the scalene muscles, and so I'm going to show you a quick way that you can do a self first rib mobilization. All right, I'm going to back the camera up just a touch to shoot that. Okay, alright guys, I'm back. Okay, so stretch strap, you can use a belt, you can use sheets, long towel, beach towel, whatever you got, don't care. Alright, what we're going to do is we're going to take that strap, let's say we're going to do the left side. So I'm going to take that strap, I'm going to put it on the table, surface, chair, whatever you have, bed, don't care. Just make sure you're sitting on it and that it's secure and will not move. Alright, we're going to bring that strap over the opposite side, so we're focusing on the left side here. I like these stretch straps, so they got a lot of loops in them, so I can grab a hold. You're going to use the arm on the opposite side. Alright, and it's going to be right along the side of the neck. Alright, right there in that position, what you're going to do here is sitting up nice, good posture. First move is going to be slight side bending to that side. Then you're going to apply pressure. Range of motion, only take what you have. Do not try to force this. Your range of motion, because you're limiting some of those structures, is going to be less than what you think it might be. So now you come out, teeth are together but relaxed, head is level, eyes are level, so let me make that correction. And right there, I've got a really good stretch going on. No pain at all, just a good stretch. Gonna hold that for a 10-second count and then come out, release your pressure. All right, relax for a second, reapply your pressure. Side bend, reapply more, hold that, pin that first rib down, and we're gonna come on out. Good stretch, good stretch. Hold that for our time, 5 to 10 seconds, should not get painful. All right, then we'll come back out and relax our pressure. You're gonna do that 3 to 5 times, depending on your tolerance. This one, I still recommend most people do this bilaterally. If you tend to have a symptomatic side, you can focus just on that side. Scalene release or scalene stimulation, I would still do on both sides, even if I only had one side that's symptomatic. And then I would do my activation. My first rib mob I would do primarily on my symptomatic side. All right, and then coming right off of that first rib mob, we'll go right back into our deep neck flexor activations. Cool? All right, guys, hope that helps. Got any questions, drop a note in the comments, email us, call us, text us, whatever. All right, Paul Kowalski, Vallejo PT Online, and good luck. We'll see you soon. Bye.